There is a very specific kind of loneliness that happens inside of healthcare. It's the loneliness of sitting in an exam room, hearing words you don't fully understand while your life is quietly changing in real time. And everyone around you seems to assume you understand what's happening, but you don't, at least not fully, because you hear diagnoses, medications, treatment plans, risks, procedures, lab values, side effects, probabilities, and instructions, while emotionally trying to survive the moment itself. And that changes everything. Healthcare is not just medical, it's emotional, psychological, it's deeply human. And for years, I carried this feeling that I was somehow failing at being a patient because I did not always ask questions. I did not always understand what was happening. I didn't always advocate for myself, and sometimes I stayed quiet simply because I didn't want to inconvenience anyone, even when it was my health, my future, my life, and that silence caused me clarity. And that experience is one of the biggest reasons I built alvora.health. Not because I wanted to replace doctors or not because I thought technology had all the answers, but because I knew what it felt like to walk out of healthcare conversations carrying confusion, carrying overwhelm, fear, and unanswered questions, and the exhausting responsibility of trying to piece everything together afterward. So today, I'm going to tell you the real story behind alvora.health, not the startup version, not the polished founder version, but the human version, the patient version. This version is built from dialysis, transplant lists, medication overload, uncertainty, fear, survival, and years of feeling emotionally lost inside healthcare. And more importantly, I'm going to talk about what I wish existed for me during those years. Because if alvora.health had existed back then, there's so many moments in my life that may have felt less frightening, less isolating, and definitely less confusing. So let's dive in. So growing up, I was tall and skinny, and I used to wear baggy clothes all the time. Um, Yeah, it was just, big shirts and loose pants and I just hid my body a lot. And at the time, but looking back, I didn't want to draw attention on my body. And plus, I felt comfortable in those clothes. But one day, everything changed in a way I never expected. I was attending my grandmother's funeral, and for one of the first times, I actually wore a skirt. And so instead of people mourning, I had so many relatives commenting on my legs. They were saying like, "Oh man, your legs look huge. Wow, your legs look swollen. Oh my gosh, you look like you got these cheerleader legs." And at first I didn't understand the significance of those comments, but my mother did, and thankfully she paid attention, and that led to doctor appointments, more testing, and eventually false positives, confusing results. Lots of lab work, and finally a 24-hour urinalysis. And at that time, I had absolutely no idea what any of that meant. I didn't understand autoimmune disease, kidney function, lupus nephritis, chronic kidney disease, inflammation, proteinuria, or even long-term complications. I was young, and healthcare language felt completely foreign to me. And finally, I received a diagnosis, and it was lupus nephritis and chronic kidney disease. And the strange thing about life-changing diagnoses is that the world keeps moving afterward. Folks still go to work, traffic still exists, sun rises, sets. But internally, your world has shifted permanently. And you don't even really fully realize it yet. So at first, my condition felt manageable, at least emotionally. I was just told, take these medications, monitor things, follow up regularly, stay on top of your labs. So that's what I did. Okay. I became compliant, responsible, structured. I tried to live normally, but chronic illness changes your relationship with your body. And you stop taking feeling okay for granted. And every symptom becomes emotionally loaded. And you begin wondering, oh my goodness, is this serious? Is this progressing? Is this medication related? Oh my gosh, is this temporary? Am I okay? And one of the hardest parts of chronic illness is uncertainty fatigue, because that constant mental exhaustion of never fully feeling safe inside of your own body. But still, I tried to live life fully. I traveled, I worked, pushed forward, and eventually my kidneys just declined further. And then came the words that permanently changed my life: and stage renal disease. And there's something surreal about hearing your organs are failing, especially when you're young, because mentally you still feel like life is supposed to be beginning, and you know, suddenly your life becomes organized around labs, nephrology, procedures, medication schedules, insurance, and survival. And shortly after that, everything just escalated quickly. Emergency hemodialysis, surgery for a peritoneal dialysis catheter, hospitalizations, monitoring, and fear. And my life no longer revolved around freedom, it revolved around treatment. Now, hemodialysis was brutal for me. It was absolutely brutal. I experienced migraines, was always exhausted. The physical depletion afterward, oh man, there were some experiences that are difficult to fully explain unless you live them, and dialysis is definitely one of them. Your body just feels exhausted in a way that sleep does not fix, and emotionally, your relationship with time changes because now your survival is dependent on machines, appointments, supplies, numbers, and then eventually I transitioned to peritoneal dialysis. And in some ways, it gave me some flexibility. I became deeply familiar with the dialysis solution deliveries, Baxter supply orders, sterile techniques, fluid exchanges, infection prevention, and the emotional weight of knowing that my life depended on that. But I still lived. I traveled, I worked. I even spoke publicly about peritoneal dialysis, and at one point, I even participated on panels discussing the advantages of peritoneal dialysis because I refused to emotionally surrender to the idea that my life was over. But beneath all of that resilience, there was still fear. And there was still confusion because I was constantly navigating medications and changing labs, fluctuating symptoms, body changes, side effects, complications, and information overload. And one thing I deeply wish existed back then was something that helped me actually understand what was happening, not just receiving information, but understanding it. And eventually, I ended up on transplant lists in Vermont, Massachusetts, Tennessee, and Florida. And I was on five different transplant lists. And that process alone was emotionally overwhelming because transplant evaluation is just not medical. It feels psychological too, because you begin wondering, am I healthy enough? Am I sick enough? Will someone choose me? Will I survive long enough? Will this ever happen? And, in the meantime, my body continued changing. I lost weight and my complexion darkened, and my medication list just kept growing. And the peritoneal dialysis caused fluid retention in my abdomen. I developed a hernia. And there were moments where I barely recognized myself physically anymore. But eventually I received a call and got a transplant. And for so many people, this is where they imagine, hey, the story becomes perfect. But for me, some of the hardest experiences came afterward. Now, post-transplant recovery was incredibly difficult for me. My immune system struggled under the weight of the immunosuppressants. My blood counts dropped dangerously low, and I needed blood transfusions, plasma transfusions, and ICU care. And even now, there are parts of that experience that still feel emotionally unresolved. And to this day, I'm still unclear about the details surrounding my donor information. And that stayed with me. So, let me just say this clearly now. I am grateful. I am deeply grateful for the care, for the science, for the additional years of life. But gratitude and frustration can coexist. And one of the hardest parts emotionally was feeling like I still did not fully understand what was happening to me. I wish I had asked more questions. I wish I had slowed the conversations down. I wish I had someone sitting beside me during my appointments, helping process the information afterwards. And when your life is emotionally tied to the outcome, clarity becomes harder. It's not easier. And I stayed quiet too often because I didn't want to seem difficult. I didn't want to inconvenience my providers. I didn't want to sound emotional, and I assumed they were too busy. But silence does not create understanding. And years later, I now realize that patients should never feel guilty for wanting clarity about their own health. Now, over time, I began noticing something larger than my personal story. Healthcare confusion was everywhere. Patients were constantly leaving appointments overwhelmed. People had these hot dates with Dr. Google at 2 a.m., trying to better understand the labs, panicking over the portals, misunderstanding the diagnoses, avoiding follow ups, emotionally spiraling, or just feeling too intimidated to ask questions. And I realized this was not an intelligence problem. It was a communication problem because healthcare gives people enormous amounts of information during emotionally difficult moments, using language that most of us were never taught to understand, and that gap creates suffering, not just medically, but emotionally, psychologically, and relationally. And I kept thinking, what if patients had something that helped them process healthcare information more clearly? Not replace doctors, not diagnose people, but to help them understand their labs, break down terminology, organize information, prepare questions, and feel less alone navigating healthcare. And that idea eventually became alvora.health. Now, if alvora.health existed during my healthcare journey, I think it would have helped me ask better questions, understand my labs a bit earlier, process appointments afterwards, recognize my patterns more clearly, organize my medical history, and feel more confident participating in my care. But more than anything, I think it would have helped me feel less lost because confusion compounds fear and clarity reduces helplessness. And patients deserve explanations, transparency, context, and support, not just data, not just portals, and not just rushed conversations. Now, I built alvora.health because I know what it feels like to sit inside healthcare uncertainty for years. I know what it feels like to hear terminology you don't understand, or feel afraid to ask questions, or carry confusion silently and leave appointments still overwhelmed afterward. And I also know that patients deserve better, not perfection, not impossible promises, but just better communication, better understanding, and better support navigating healthcare. And that's simply because better clarity leads to better understanding. And lastly, better understanding changes healthcare experiences forever.